Well, hey there! I'm Dr. Chung, and welcome to your friendly proctologist. I'm so excited that you've decided to join the community today. I mean, that's what the internet and YouTube is about, is we're helping each other. We're growing our personal experiences, collectives, and bringing them together. I invite you to comment and share your story, share your solutions. Let's all learn from each other. That's what this is about, to help each other with our bottom ends that are suffering, right? And today's video, I want to bring you a video that's been requested no less than 5,000 times, and it is the O'Regan CRH banding technique. And I know I've been so late with this, I apologize, but I've been needing to do research on it so that I can bring a more comprehensive video to you, okay? So we're going to talk about what it is, how it's done, and what I think about it, pros, cons, etc. Before we get there, I want to talk to you about a sponsor of this channel, and that is Revival XR. This is a supplement for your sitz baths. This is the exact packaging that it comes in, and they sell it on Amazon. So it's very convenient to get. I want to let you know that this supplement is very comprehensive. So if you're looking for something other than just Epsom salts, but you don't want to buy like 17 other bottles of stuff, this is your pal right here, because it has all these organic ingredients: chamomile, frankincense, coconut oil, Dead Sea salt, etc., etc., so that you can maximize your potential for healing and soothing experience for your sitz bath. And we're talking about hemorrhoids today. This is what I personally use for my sitz baths, and I find the relaxation benefits to be absolutely excellent. They have been gracious enough to provide a discount code when you order on Amazon. It's Dr. Chung. So go ahead and use that coupon. Thumbs up to Revival XR. Thanks so much. And I will get back to Revival XR towards the end of the video, okay? So let's talk about the O'Regan technique. Now, full disclosure, I hate being a liar. I hate misleading people. So I'll tell you, I have never used the O'Regan technique. I have not seen their technology. Nobody has come in here from the O'Regan factory or O'Regan company to talk to me about it. I don't have any of their education materials. I only use what's available online to you and me to get this all figured out. But I am a surgeon, and I do banding extensively. I also do hemorrhoid surgery. Oh, really, Dr. Chung? No, duh. So, do I understand what they're doing? Yeah, absolutely. But I need to let you know that because, hey, it matters, okay? So, let's go to some pictures. This is stuff I Xerox or photocopied online, and I wanted to bring that to you here, okay? The first picture that I want to show you is the actual instrument right here. This is the syringe that they want you to use to do the bandings with. And the syringe has a tip on it, okay? This is actually a hole with a rubber band at the end of it. And what you do is you pull this syringe back, okay? When you do that, it's like a syringe where you produce a vacuum. So there's a suction force that you create here. The hemorrhoid is going to be on the end here, inside your bottom end, and it's going to suck in the hemorrhoid inside the mouth of this guy. And then when you're ready, the doctor or provider is ready, they're going to fire it. Most likely it's one of these plastic tabs to fire the rubber band to kill that hemorrhoid. So when you look back, when you look more on their materials here, you can see, I'm going to get this centered for you, that this is how it's done. You have the person's anus here, you put the syringe inside the bottom end, and you get that hemorrhoid target, right? Then you apply the suction on, you pull that plunger back, and oh man, you're going to get a nice juicy hemorrhoid inside this hemorrhoid banding O'Regan device, right? Then what's next? Number two is that the rubber band is on the hemorrhoid, and you see that. It's kind of at the base of the hemorrhoid, which is ideal for any banding procedure, and it looks like a very successful placement. Then number three here, you'll see that the hemorrhoid, the enlarged hemorrhoid, is completely gone. It's a successful procedure, you know, and that's the basic technique for the O'Regan instrument here. And what they advertise on their website is that it's a simple procedure. It's fast, like 5-10 minutes. It's easy. You know, the practitioner, lots of people can be trained to do this. Painless. Doesn't hurt when it's being done or afterwards. You can go back to life easier. And the complication rate is very low. And so these are the things that it's advertising on its website. You know, what it wants you to do is, if you got hemorrhoid issues, give this technology a try. You can do this multiple times on a hemorrhoid. And because the complications are so low, it's worth a shot. That's really what they're advertising here, because banding is already established as a very effective therapy for hemorrhoids. Why not try this O'Regan? Lower pain, better, faster recovery. And they've got this smart little chart in there that compares regular banding to their O'Regan banding and other types of hemorrhoid treatments. And they said theirs overall is better. That's how they're trying to convince you of it, right? Well, let's talk about another thing here. Let's talk about some pros, cons, and my critiques on it, okay? And oh, let me show you one more thing. I want to kind of show you with this syringe. It's the exact same thing here, but it's just another way of showing it, because this, instead of a picture, it doesn't move. So you've got your plunger here, which is the same thing on that O'Regan. You've got the end of the instrument, or excuse me, end of the plunger or the syringe, which is going to suck up the hemorrhoid, or my finger here, right? So you pull back on this plunger syringe. You're going to create a suction or vacuum in here, which is going to suck that hemorrhoid inside here. Put a rubber band on top of the hemorrhoid, and then you remove this, and eventually the hemorrhoid is going to die and fall off, okay? So I hope that this all explains very well to you how it works. So I'm going to grab my handy list here. Let's go over some pros, cons, and critique. Okay, so let's go over the pros. I've got two here. Number one is that any practitioner can do it. It's so easy to do, and you know, you don't have to wait for a specialist to have this done. You go into your medical doctor, and guess what? They can have it available to you. Seeing a specialist takes a referral sometimes. You gotta get authorizations, and plus they've got longer waiting lines, right? 3 months maybe to see a GI doctor, maybe 3 to 6 months to see a surgeon in your area. And who's got that time to wait? I want that hemorrhoid treated now. Nurse practitioners can do this, physician assistants can do this, medical doctors, ER, urgent care. I mean, the list is really endless, and I'm sure these guys are working hard to try and bring their technology in every doctor's office. But that's a benefit, you know? I can get a treatment done fast, easy, anybody can do it. Number two is that banding is a very safe procedure. I agree with them on that. I do bandings all the time, not with the O'Regan, but it is a very safe technique. And they're touting their technology to be even safer than the normal banding. And I'm not so sure about that, to be honest with you, but the reason probably is because of the fact that when they pull the plunger, okay, they're sucking up the hemorrhoid. The force that they bring that hemorrhoid up and band it is lower suction power than someone else using a machine to create suction. So they may be trying to say that without, you know, saying that explicitly on the site. They just say it's safer. But hey, that's what they're claiming, okay? So in general, again, banding is safe, and so is the CRH O'Regan. I believe that. It is a safe procedure. Okay, so now we're going to get to the cons of this procedure. The biggest con with this procedure is that it's done completely blind. What does that mean? It means that you don't see the exact hemorrhoid that you're targeting to put that rubber band on and kill. Okay, what I do when I do a hemorrhoid banding is I put a scope inside your bottom end, and then I can actually see inside the scope. I can find out the hemorrhoids. I can tell you which hemorrhoids are a problem, how many of the hemorrhoids I can potentially band, and which one's bigger. And because I want to target the largest hemorrhoid, because the largest hemorrhoid is typically the one that's going to bring you the most symptoms. If I just kill a small one and leave a huge one behind in your bottom end, you're not going to feel any better, because that once that small one dies off, that big one is still sitting there, and that's what was totally missed. So with this O'Regan technique, there is no scope. You don't put a scope in first. What you do is the patient's anus is closed, and they're sitting there on the table, on the examining table. They put this syringe. I'm going to use this syringe and pretend it's the O'Regan, okay? They just put this inside the anus like this, okay? And then they pull the plunger back, and they try to get a hemorrhoid. Who the heck knows what they're getting in there? And then they put the rubber band on, and then they pull this thing out, okay? How the heck does anybody know what the heck they're getting in there? How do they know how deep to go? What if they go in too far? What if they completely miss it completely? You know, a lot of the practitioners that are doing this probably don't even know or have done an anoscope, okay? They're just saying, oh, sir, ma'am, you've got bleeding. Okay, you know what? Let's try an O'Regan technique banding here, okay? How do I know they're not using a scope? Because this technology does not use a scope at all. So why would you bother using a scope beforehand, take it out, and then do it blind, okay? That makes no sense at all. You know, if you're going to be finding the problem and targeting it like, you know, a sniper, right? You got the sniper rifles and you're trying to assassinate a hemorrhoid. You got to look, open up the bottom end, then target it exactly where it's at, and then destroy it. That way the doctor can tell you, hey, I've got that one for you. It was a super juicy one. That's what I love calling it, super juicy, because yeah, when they're big, they definitely get sucked up and they turn into this big juicy red apple of a hemorrhoid. And I tell you, yes, I got it, sir, ma'am. You know, that one definitely is going to feel a lot better after he gets killed off. But how the heck do these people know? These people are not surgeons. They're not even, you know, they could be GI doctors, but this makes absolutely no sense. Where the heck are you putting that? And when you suck on it, are you pulling back and making sure that you're getting the hemorrhoid on the top that you want? Or maybe the hemorrhoid's on the bottom. Is it left or right? It makes absolutely no sense. The people are doing it. You can just put a blindfold. I can just close my eyes, put this in, and say, oh yeah, there you go, man. There you go. Congratulations. You just got banded with the O'Regan technique. Completely no assurance of that you got the largest hemorrhoid. No assurance that you did anything of value. You don't even know whether the hemorrhoid band landed on something successful or not. No idea. You have no clue. And that's the hugest problem with this, okay? Okay, so the other problem with using that device, when you put your finger in your bottom end, what does your anus do? Your anus spasms and clamps onto that O'Regan syringe or your finger here, okay? And so if you think that people are going to put that in there and then the anus is squeezing on it and they're just going to pull willy-nilly in outer space and get a hemorrhoid in there, they'll get something, but do you know if that's the right one? No, absolutely not. The second biggest con is that anyone can do it. But is that what you really want? Do you want someone who doesn't specialize in hemorrhoids or doesn't really have the knowledge about hemorrhoids to be doing it? Because what if there's a problem or a complication with the device? Let's say the hemorrhoid, the band actually lands on something painful. Now the patient is screaming in your office. Or let's say there's a problem with the syringe and things just start bleeding because they got a really sore hemorrhoid and now the patient is bleeding on the table. And that person doesn't know how to handle something like that. You think a medical doctor, your primary doctor, knows how to handle that kind of situation? No, absolutely not. Is that a funny situation? Absolutely not. You are the one that's now in a potentially life-threatening situation or very painful and uncomfortable situation because of this complication that occurred. That should never have happened. And it's really, really unfortunate. And it's the main thing of why these things could happen is because you don't see what you're doing. You know, the doctor could be like pointing it upwards. It could be pointing left or right because they don't know how to insert something into the bottom end. You know, there's a very specific angle, and if you don't do it at the right angle, it's be very, very uncomfortable, okay? So a lot of bad issues that could potentially come up, and especially if it's a nurse practitioner or a physician assistant, I'm sorry, these people do not have the experience, okay, or the knowledge to know exactly where the problems are. Do they really know the difference between where the internal hemorrhoids start and external hemorrhoids start? Because that's where the pain could be a problem. Do they understand where, you know, do they understand the complications, how hard to pull on it, and et cetera, et cetera? Honestly, the people that really know the most about hemorrhoids are the surgeons. And I'm telling you, do you want a surgeon on your side if a problem were to occur? Yeah, heck yeah, I would. And I'm biased, I know, but we are the people that would know exactly what to do and when and how to recognize a problem right away. Con number 3, this technology is built for people who do not have a good knowledge base of the anus, of the hemorrhoids, all of that, okay? Why? Because they made it so dumbed down and so simple that anyone can use it, that they want it to be something very approachable for any doctor or practitioner to use. That's why you don't need to use a scope and take a look and find the hemorrhoids. You just literally stick this pole into your bottom end and you suck on it. Hopefully you got something, who the heck knows, and then you fire a rubber band on it. Nowhere in their procedures does it say use an anoscope to confirm what you've done. Make sure that it's safely landed on a hemorrhoid that you intend for it to be on, or make sure it's going to be helpful to the patient so that you don't waste your money coming back again and again and again for that procedure. Again, the more dumbed down a procedure is, sometimes it carries a very big cost, because if you don't recognize a problem, that's where complications arise. If you're able to double check and know potential issues, that is the marker of a truly knowledgeable specialist. And I'm telling you, these medical doctors, urgent cares, nurse practitioners, whoever, they do not understand that, nor will they be able to get you out of a complication. Okay, so let's go over the critique, overall feedback, kind of combining the ideas. What do I really think about this thing? The first thing is that, is this really a new type of banding? Is this a new technology? No, it is not. They are reinventing the wheel. They are repackaging banding and saying, hey, look, it's way better. Absolutely not. This is a marketing ploy. They come up with this interesting looking syringe and it looks so dumbed down and easy, and heck yeah, anyone can do it. Look at the instructions and just go ahead and suck and pull band. Done. And that is very, very misleading. This is no different than a regular banding, except that in my opinion, it's got more risks and problems attached to it. So they are reinventing the wheel. It's a marketing tactic to try and get you to spend money and buy their services. That's how a company survives. You gotta buy their product, and then they can sell more and more of it. Critique number 2 is that you've really got to ask the questions. Are people in my specialty, colon and rectal surgeons, using this technique? And I'd be willing to bet you that the answer is absolutely no. No. Surgeons, we open up your bottom end to look for the hemorrhoids and do operations on them, okay? And if the guys that are doing the operations and doing the most procedures on the hemorrhoids are not using this technology, you gotta really think about that. Why aren't they using it? Because if it's really that great and safe, well, duh, everyone should be using this O'Regan technique. There should be no ifs, ands, or buts about it. But the thing is that we're not their primary market, okay? It's not for us. So every surgeon knows that if you want to give the patient the best benefit, you've got to target the hemorrhoid that's the biggest, that's causing the most bleeding, causing the most symptoms, fullness, or whatever it is. And the best way to do that is to use a scope, Okay, you got to look in there, you got to open the butt cheeks, put the scope in, and then you've got to do a survey of the inside. Typically, it takes 2 passes of the scope, unfortunately. One scope to pull back and look at everything, make sure you know where the hemorrhoid is, and you compare all the sizes of the hemorrhoids, and you give a report to the patient. I tell you, sir, ma'am, you've got 4 in there that could potentially band. This is the one that's causing the most problem. That's the one we're going to get today. Okay, and then after you do that, we've got a suction machine that pulls enough suction so that we can pull as much of that hemorrhoid as possible. Okay, we want most of that banded or sucked into the instrument, and then put the rubber band at the bottom of the hemorrhoid, at the root, at the base of it. That way, when it dies, the whole thing dies. That's the whole thing. We don't want to keep banding over and over and over again. And with this O'Regan, it's just a simple little syringe that you pull back. So is there much force in that? Well, maybe, but you definitely got to make sure that you use 2 hands to pull it, because if you just pull it a little bit, maybe you'll get a tiny little incy-wincy corner of the hemorrhoid, and then you're banding a little ditzel. And that's not going to do anything. Patients you're not going to notice any improvement. And that's an issue, right? Because you got to come back. And then you got to be subject to another procedure, which subjects you to more possible complications, in addition to wasting your time. And again, like I said, there's no way of the people that use the O'Regan, there's no way of them knowing if they did anything right yet, or wrong for that matter. Critique number 3 is that if you lack the knowledge about hemorrhoids, about how to treat them, everything is going to look like a nail to you. Okay, you've heard that expression. If you're a hammer and you don't know what you're doing, everything is going to look like a nail, and you're going to want to band everything in sight. All you need the patient to say is, I've got bleeding, I've got some hemorrhoid issues, or I had a bad bowel movement and bleeding. And say, oh, cool, let's use the O'Regan. It's going to make you feel perfect. I don't even know what the heck your hemorrhoids look like, because I guarantee you they're not going to do an anoscope and check. But heck yeah, we got this O'Regan syringe. We're going to put it in your butt. Totally safe. It's going to pull something. It's going to grab a hemorrhoid. Don't know which one, but it's going to make you feel better, I promise. And you put the band on, you're out of there, and you go out with a happy face. That is the problem with this, is that this technology may become overused. The doctors are just going to keep using it for everything and everybody. And you know what? It's a scam. Okay, because if you don't know why you're doing a procedure, you don't know if you're going to get the job done right, you're basically billing the patient. You're trying to charge money for a procedure for nothing. Okay, and that's a huge, in my opinion, that's a scandal. I mean, that's the definition of it. You're trying to make it used for everything, and guess what? Doctors make more money on procedures. So you go in for a checkup, they charge you for that. Then they decide that, hey, we should do an O'Regan. That's another separate bill on whether it's cash or whether they charge your insurance for that. Critique number 4 is people outside my specialty do not know how to properly diagnose anal conditions, okay? Why? How do I know that? Because hardly any doctors actually open your butt cheeks to look at your hemorrhoids. And then even less doctors use a scope to look inside your anus where the internal hemorrhoids are. Really think about that. How the heck is any doctor supposed to know without looking? And how the heck are they supposed to come with an accurate diagnosis like, this is your problem, I understand this, therefore this is the treatment? How many of them actually how can you say that? How can you convince someone that that's what's going on? And so that's a huge problem. If you don't know how to properly diagnose an internal versus external hemorrhoid, anal fissure versus hemorrhoid, anal spasm causing bleeding on the inside, anal polyp, etc. The list goes on and on and on. If you don't know how to figure it out, do the moves or maneuvers, the exams that help you to sort out the different problems, how the heck can you be doing the O'Regan? Because if you've got, for example, an anal polyp that's creating the hemorrhoid issue, you say you feel like there's something going in and out, and I've got bleeding, and with my hemorrhoids. And the doctor said, that sounds like a grade 2, maybe grade 3 internal hemorrhoid. You know what? the O'Regan technique might be something we can use. So they put that in there. But the thing is, they grab a hemorrhoid. You can't grab a polyp with that syringe that they give you. And they say, okay, great, sir, ma'am, you're going to be fixed. See you later. But guess what? It doesn't do a single thing because that's, you know why? Wrong diagnosis, okay? And that's why it's very important. I'm biased, okay? Yes, I am very biased. But you've got to see someone like me to make sure in your head I've got the right specialist who can accurately pinpoint my problem. I don't have to worry or doubt that they have solved or diagnosed my problem. That's extremely important, right? With bottom end conditions, our mind tends to wander. And if they don't have the knowledge, that's huge red flag number one, that they're not going to be able to figure it out. Critique number 5, and this is a hard truth. Doctors are out there to make money. Like I said before, healthcare is a business. They need you to come in, and they're competing clinics to clinic, hospital to hospital, doctor to doctor. Come and see me. Don't see that other guy or woman. I can take care of you. Give me your dollars, insurance or cash, whatever. And so they think that because they can get the newest technology, they can draw you in. Because O'Regan, again, super simple, easy, and no pain, no complications, right? But look underneath the sheep's clothing. This is a way for people to make money off of you, okay? Instead of making the correct diagnosis, maybe changing your habits or really taking the extra 30 minutes or 20 minutes to talk to you about how to fix certain things, they're more willing to do a procedure for you and cause a potential complication, okay? Because I'm telling you the truth, an office visit is not that much money for the doctor to bring in. But if they do a procedure on you, they might collect an extra $100, $200 for doing that. And what the heck, you know? You're going to feel better because you're getting some treatment done, and the doctor's going to feel better because, hey, they can make that monthly payment on their new Porsche, okay? I mean, that's just to tell you that this company, O'Regan Company, their objective is to get as many doctors as possible to use this on as many patients as possible, because each unit that they sell and use on a patient is money in the salesperson's pockets, money in the company's pockets, okay? And they even have say here, it's approved by insurance companies. So come on in. You don't have to spend your own dollars, but I'm telling you that this will, if you have high deductibles, you're going to be paying for this out of your pocket somehow, some way. And so this is the great scandal here, in my opinion. When pharmaceutical companies, when device companies want you to just find the sexiest technology possible because the marketing sounds so good, it sounds so fantastic, that all they want you to do is not think about whether the practitioner is doing something right or in your best benefit, but instead just make a few bucks off of you. Here's another thing too, is that internal medicine doctors, like your family medical doctors, can't really do very many procedures. They might be able to lance a boil or something like that, because I'll tell you, the money is in the surgical procedures. That's why in general, surgeon type specialists on average make a lot more money than the internal medicine or family medical doctors. But what can make the playing field a little bit more even, or, well, not even, but what can bring them more money, the family doctor guys, is procedures like this, okay? And it's dangerous because they don't know anything specific about the hemorrhoid anatomy or anal anatomy or diagnosis. It's dangerous for them to be just willy-nilly using this and saying you've got hemorrhoids and just try a banding. And so that's where the conflict of interest comes in, okay? They want, of course, every doctor wants to help you from the goodness of their heart. But when money comes into the picture, conflict of interest, I want to make money for the practice. I've got to pay my staff. So here's the conflict of interest, right? The doctor needs to make more money, obviously wants to help you, is trying to work in your best interest, but how do you know that they're not just in it for the money? They're not doing the procedure only to get more money, you know, because the more of these they'll do, they'll see their profits rise. It's a serious problem and something that I am desperately fighting against. Critique number 6, I think it's number 6, but how do I know that this O'Regan or banding in general is causing issues? Like, Dr. Chung, why are you making such a big deal about the O'Regan? Like, why are you trying to make it such this devilish thing? It's safe. Banding is all good. And you're right, it is. But that does not explain the disasters I see in my office. I've had patients banded by PAs. I've had patients banded by GI doctors. I've had patients banded by general surgeons. And they've come to me with severe pain problems, severe anal spasm issues, severe muscle injuries, severe bleeding issues and flare-ups from the missed bandings, and it's all because of a lack of knowledge. Okay, do complications happen to me? Yes, they do. Okay, yes, they will. Okay, I'm not saying that I'm perfect, but a lot of these things can be avoided if they actually understood what hemorrhoids are about. Okay, and that takes the extra training, and that's why I've studied the butt for an extra year in my training with my fellowship for colon and rectal surgery here, okay? If banding was seriously that safe, I wouldn't be seeing any of those types of patients in my office wanting me to fix their hemorrhoid issues. It simply wouldn't exist. And so I'm telling you to be very, very careful about these new technologies because they're being marketed, they're being sold to you as this new thing when they're just reinventing the wheel, man. And the thing is, when more people are doing it, more problems will arise from that. All right, so in general, in conclusion about this O'Regan technique is that it is safe, and really the best thing about it is that it opens up access to more hemorrhoid procedures to so many more patients. Because we know how common hemorrhoid issues are. And if we can get people in to see and get procedures done to get their hemorrhoids banded, then that's terrific. You don't have to wait 3 months or 6 months or suffer for such a long time. But understand at the same time the complications, this procedure, the issues or potential complications. This procedure is done completely blind. They might as well have a blindfold over their eyes and say, here we go, I'm going to band that one for you. Okay, understand that the severe cons of this technology, and don't fall into this marketing technique. They're just trying to sell you something. They're making it super sweet and sexy sounding, but I promise you, they're just reinventing the wheel. It's still a wheel in the end. It's got spokes in it, and it's got a round outside. Banding is banding, banding is banding. But this one, if it's blind, I don't know what the heck that person is doing, which is the scariest part to me, okay? Either way, take the information, use it to see what is going to work out best for you, and I really wish you the best in your recovery. So we'll get back to Revival XR. I invite you to go onto the Amazon page, use the link below, and use their coupon Dr Chung. Again, this has been a comprehensive sitz bath supplement that I use personally, and really the essence, the scent of it is excellent because it's so subtle. I don't get sick and like dizzy because it's so, that fragrance like potpourri sometimes can like burn your nose or make your brain feel like it's mush because it's so strong. This doesn't do that. And plus, it's very, very soothing with the oils that it comes with and the salts. It's got every single essential ingredient. So I encourage you to try a bag out today, and I wish you the best. You take care. Bye-bye.